Copperbelt Provincial Health Director Robert Zulu has commended the Rotary Club of Ndola-Mukuba District 9210 for continued efforts in the promotion of maternal health. The Rotary Club is injecting 1.2 million kwacha to train safe motherhood action groups targeted at helping improving maternal health in communities. Andrew Mbazema has more.
Last week, we had 4 people dying from Ndola, mothers who are pregnant. Last 7 days. And it shouldn't happen.
It is such sad statistics that are calling for a vigorous approach towards ending maternal mortality rates in Zambia. This is why safe motherhood remains critical on universal health coverage agenda. Against that background, the Rotary Club of Ndola-Mukuba, District 9210, continues to implement safe motherhood programs in communities around Ndola. The goal is to ensure women receive the care they need in order to be safe and healthy throughout pregnancy and childbirth. For many years now, they have been training safe motherhood action groups to spearhead this. The training is anchored on a bedrock of collaborations with health experts. Today, these men and women are the latest addition to a training program that will see them graduate and become part of the safe motherhood action groups.
Every time, whenever you are in this particular training, bear in mind, just yourself, say, oh, I've come here because I don't want any woman to die while giving birth. That should stick to our mind. That's why you are here. That's the most important thing. You don't want any woman to die while giving birth or after giving birth. Immediately you go into the field and identify yourselves. You are not going to look for pregnant women in our communities. I can assure you, pregnant women will look for you to come and tell you their problems. And that's what we want. Because you are established. They know that twayakulu wanamulenga, twayakulu wanabanda, they will tell us what we are supposed to do as pregnant women. So, definitely, I know and I'm convinced you are going to get the know-how which you require.
The outcomes of this training program are crucial to the development targets that border on ensuring the health and well-being of mothers and their children. Selfless service is what is expected from this group.
At the end of your training, by Friday, when I come back to close the meeting, I like the following objectives, which some of them have been stated to be fulfilled. Our President-elect, Mr. Zulu, please continue to support these trainings. It's very important that we train the 125 that we've put in place. The SMAGs, you need to be very, very, very clear why you are here. It's not like any other workshop. First of all, early attendance to antenatal clinic is very important. Now, fine. The first 12 weeks of pregnancy, a woman should go for antenatal clinic. So we depend on you as Max. You need to discuss it in the community. You need to tell the women, the first time they miss their periods, they think they are pregnant. They should run to the clinic and make sure that they are attended to. Objective number 1. Definitely, because we know that early attendance to antenatal clinic can prevent complications. We shouldn't wait for complications.
For the Rotary Club of Ndola-Mukuba District 9210, training 125 Safe Motherhood Action Group members is feasible. This will unfold certain incentives to champion the No Woman Should Die When Giving Birth campaign.
At the end of this program, all these women, 125, will be trained. They'll be provided with enablers. And one of the enablers is bicycles. Each one of them will go back home with a bicycle, a bag, and any other utility items which they will be using as they go into the community.
Today, the community-based volunteers vow commitment to playing their role effectively once equipped with knowledge and skills.
What we want is to reduce maternal mortality and child mortality. This is what we want to see in the community happening. And we want as well to improve male involvement in safeguarding the lives of the pregnant women and children.
Ndi committed kuli project yaba Smag okulafurisha bana mayo kubulaba kuba kinchi okulaba ku kipatala n'okupapira ku kipatala n'okulembesha bwangu nga bakwata amafumu.
Service above self is the hallmark of the Rotary Club operations. Testament to this lie other programs meant to leave positive footprints.
We have the End Polio program, which we are proud to say that that one, the whole of Africa, it has been certified polio-free. All these things are there to save lives. We are also in the program of malaria, to end malaria in this country. It is all through Rotary. So our desire is to save the community. That is our motto, saves above self. We feel happy when we see a smiling person, we see a woman smiling, holding her baby, and the baby is smiling. That gives us pride as Rotarians, and we are happy to continue to do that.
Andrew Mbazima, ZNBC Focus in Ndola.